Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah hari ini kita masuk ke pertemuan 9 di mata kuliah Sumber Daya Manusia dan Mutu Kesehatan. Today we would like to learning about the detailing condition of health and quality. For the first part that we have to learn is quality management concept in health. Quality management affects structure, core, internal and external ownership and customers, the quality system and almost everything system, and other segments of organization. What are the points of quality management concept in health? There are 4 points that we have to remind. The first one is health services are specific because physically and mental patient involvement in the process provide service. In other words, whilst the provision of health services is based on ongoing interactions between healthcare professionals like a doctor, medical technician, and especially for public health expert. So it's really mean about physically and mentally. It will be influencing when the way you give health care or health services to the patient or to the public. Because when you feel illness or you got sick or physically, it will be influencing the way you give health services to the patient or public. And also about your mental, when we have a good mental and health mental, it will be influencing too for the best health services to the public. And the second one is customers may have some knowledge from a professional aspect to service. The relationship between the patient and medical staff is the basis for creating input elements in the process. The third one is payment and services provision are two things completely separate activities in healthcare, usually pay for health services done by a third party. Therefore, healthcare provided must be satisfied or satisfactory not only customer needs, but also a personal pay for the health services, for example, like health insurance. So on this slide, please pause your comment, give me your answer, like what is your way for pay the health services in the hospital. For example, you will pay with by yourself or use health insurance. For health insurance, please give some explanation what kind of health insurance that you use, like health insurance from private or government. Thank you so much. And the last one is health services are characterized by the complexity of connection and interaction between patients, clients, doctors, and other health workers, medical supplies, and non-medical equipment, material and resources, health insurance, legislative, and other regulatory agencies. And the main important like quality management system, basically quality management principle in healthcare. There are the first one is customer focus. Like any organization and any private or public health service organization, while providing healthcare services must to respect to the customer. So the main point in this part is must respect to the customer. So for all of the health worker, especially for public health expert, we have to respect to the public. It's not about the we have a good knowledge or we have a good basic for public health experience, but we are a good public health worker with the good respect too. So it will be make a good relationship between the public health expert and the public. The second one is stakeholder engagement. Customers not the only group that needs and requirements must be met. Adequate value must also be given to employees, local and global communities. And health services also oftentimes requires identification of needs, expectation and requirement of all stakeholders and interest parties who apart from health and service provide insurance, including customers. And the last one is leadership. Another novelty brought in the new version ISO 9001. Leadership very important for management health organizations and their quality, the organization management system which adopt a customer-centered approach. Leaders have a role to inspire, promote, and support organizational culture quality. So the main things in this part is organization and culture quality. For the culture quality, it's mean like health management quality should be a culture in one of organization. Culture, it's mean like usually something important that we cannot take it out from the organizational process. So promote and support organizational culture quality is the main important things in the leadership part. And my question is, please answer your best answer in this part in the comment column for the definition of ISO 9001. Please give your definition about ISO 9001 in this column commenter. Put your name and your best answer. And don't forget to post your source from the definition of ISO 9001, whether the source is from online or offline for the literary review. Thank you so much for this meeting. Inshallah, we will be meet again for online class on the next meeting. I'm so sorry if in the explanation there's something wrong or there's something incomplete. Please feel free for give a question or some opinion about this meeting in this module on open learning. Thank you so much. Let's finish our class with say alhamdulillah, alhamdulillahirabbil alamin. Assalamualaikum warahmatullahi wabarakatuh.